Welcome back. The fight against TB continues, and health professionals are making strides in monitoring and identifying new cases. A study conducted in Mitchell's Plain and Klipfontein utilizes a low-cost, scalable mobile mini-clinic operated by two healthcare workers. The clinic's portable battery-operated DNA-based diagnostic tools are used to identify or track active cases. Of course, this is replacing the older smear-microscopy diagnostic methodology. Professor Keertan Dheda from the University of Cape Town and the London School of Hygiene and Tropical Medicine joins me now live to tell us more about this at least. A very good morning to you, Professor, and thank you so much for your time. I mean, I've mentioned a lot that I think the average human being may possibly not really understand in terms of the portable clinic itself and its operation. How did it come to, I suppose, existence? Maybe we can start there. And what exactly, to the layman, what it does?
Yeah, thanks for having me. And I think just to take a step back, the problem we're dealing with in South Africa, and I think everyone knows we have a huge TB problem, is the problem of what we call the missing cases. And what those are, it's a startling statistic that of the roughly 400,000 newly ill people every year in South Africa, about 150,000 of them remain undiagnosed or undetected. And these individuals are often residing in the large cities and peri-urban informal settlements. And essentially, it's only when they become ill and they develop symptoms that they seek care. And we call this passive case finding. And what really this is all about is changing this paradigm and taking diagnostics out of healthcare facilities and laboratories and taking it out into the community to find cases. So we performed a study where we developed a model which used a low-cost vehicle and used portable DNA-based diagnostics. So these are tests which look for the genetic material of the bug in the sputum. And these are the sort of frontline tests being used in South Africa. But we took this one step further by putting together a model where we could put battery-operated diagnostics like these in low-cost vehicles and take these diagnostics out into the community. So that's what we are talking about, and that's to address and to find these individuals who are undiagnosed with TB. And what we found essentially in the study was a lot of TB. We found that about 10% of the people we screened, in the community, particularly informal settlements, we found the rate of TB was 10%, which was astronomically high. And interestingly, we found that despite using these very advanced and sensitive DNA-based diagnostic tests, we only picked up half the burden of TB compared to traditionally growing the bug, over several weeks, which is very expensive and which we don't routinely do. But the punchline of the study was that we detected almost all the likely infectious cases, and these are individuals who are likely to spread disease. And so the punchline of the study is that by taking diagnostics out into the community, you make the diagnosis early, you put these individuals on effective treatment, and you stop spread of the disease, because by the time they self-declare to healthcare facilities, a lot of the damage is done, and you've amplified the TB epidemic. So that's in a nutshell what we did and what we found. And the findings of the study was published 2 days ago in a journal called Nature Medicine, which is a very sort of prestigious journal to publish one's work in. And they obviously recognize the importance of this finding in that it advocates for a change on how we do things and public health strategy from a passive case finding one to an active case finding one.
Professor, firstly, thank you for helping us, ordinary human beings understand exactly what it is we're dealing with here. But I want to put it to you that identifying, monitoring, and being able to fast track the abilities to do the identification and the monitoring is important, yes, but it's one step. The other more important step is actually combating TB. So to what extent, or to how possible does it make it, and how easier, rather, let me put it that way, how much easier does it make it when you can fast-track the monitoring and identifying of TB cases to actually combating it and fighting it and decreasing, just the prevalence of it? You're finding it easier and better and quicker, but are you able to fight it easier and better and quicker?
Yeah, I think that's a critical point. In other words, we know what we need to do, but are we really doing it? And I think a few things. Number one, I think this advocates for the fact that we have sort of put together this package or technology in South Africa. We know it works. So we should be really advocating for rolling this out now. We did have an initiative sponsored by the Novartis Foundation, where we actually did this and put some of these mobile clinics out. We are talking to the Department of Health about expanding this program. And you mentioned there are so many other things that need to be done. Unfortunately, we don't have an effective vaccine for TB. And this is only one of many things that we could do. The problem with a diagnosis and treatment, and why it has a limited impact on the disease, is that, as I said, by the time the diagnosis is made, there's a lot of transmission of disease, so it has a limited impact on reducing the scale of the epidemic. Of course, the main thing we need to address in the country is things like poverty, overcrowding, unemployment, HIV, smoking. And so these are a lot of other things that can be targeted that will have a massive impact on reducing the burden of tuberculosis until we find an effective vaccine.
It's a fight, Professor, and a very long one, but one that all that are able to, in terms of stakeholders, are invested in, and ensuring that there is a great deal of willingness to continue the fight and to win this fight. Whether or not we'll win it in good time, we do not know. But thank you very much, Professor, for joining us here on Newslink on ENCA. That is Professor Keertan Dheda. Of course, she's speaking to us about the measures and the steps that are being taken, the strides that have been achieved in ensuring that the fight against tuberculosis is being won.